Hello, and welcome to The Point of View, where we give students a place to listen, learn, and lean in. We're your hosts, Zara, Ashrita, Gayathri, and Jessica, and today we'll be talking about South Korea's declining birth rate.
South Korea is facing a serious issue. Fewer and fewer babies are being born each year. This trend is worrying because it can lead to a shrinking population, fewer workers in the future, and challenges for the economy. But why is this happening? One of the main causes of the decline is the economic pressure on citizens of South Korea. High cost of living is one of the biggest contributors to economic pressure. Living in SK, especially in big cities like Seoul, is very expensive. Housing prices are high, and everyday expenses like food, transportation, and healthcare add up quickly, which makes it difficult to have the commitment to have a baby and also take care of them until they're older, which takes money and time which many people don't have. Due to this, many young people feel like they can't afford to raise children in such an expensive environment. Education expenses play another role in economic pressure. Education is extremely competitive in South Korea. Parents often spend a lot of money on private tutoring, after-school programs, and other educational resources to help their children succeed. This pressure makes having children feel like a huge financial burden. The Korea Times states Korea's overly competitive education and declining total fertility rate, 0.7 in 2024, are social phenomena that are closely related to each other. This issue can be discussed from several perspectives. This competitive environment places great stress on students and forces them to prioritize academic achievement. Therefore, many families invest huge amounts of money in private education for their children. This adds to the financial burden and pushes parents to devote more time and resources to ensuring their children's success. This proves that parents must spend a lot of money for their kids to thrive in Korea, which adds to why its birth rate is significantly declining. Many workers in South Korea also face long hours and stressful jobs, which makes it harder to have a work-life balance. There's a strong work culture and often leaves little time for personal life or family. Because of this, people may delay marriage or choose not to have children at all. With the hard and stressful life of South Korean women, they don't have time to devote to a baby at this point of time. Social expectations and gender roles play an important role in the life of a woman in South Korea as well. Women often face pressure to choose between their careers and family life. Even though more women are working, they're still expected to take on most of the childcare responsibilities. This imbalance discourages many women from having children because this puts a lot of pressure on them. The pressure to be both successful and professional and the primary caregiver, coupled with the workplace discrimination, is a major factor in decisions to not have children. Many people, especially women, prefer individualism now rather than having a big family. They are rejecting the pressure of marriage and having children. The lifestyle in South Korea has evolved over time, and due to these standards and expectations, such a rise in pet ownership as an alternative to having children and increased focus on themselves.
South Korea's birth rate has been declining for decades, driven by rapid urbanization. South Korea underwent rapid urbanization, which contributed to demographic transition of societal changes that influenced birth rates. South Korea's rapid urbanization led to high costs of living and intense competition, which combined with an emphasis on education and career-focused work culture, has caused a drastic decline in birth rates. The shift from rural to urban areas created housing shortages and high expenses, while demanding work environment made it difficult to balance family life, pushing people toward prioritizing career and individual achievement over marriage and childbearing. Change of family life also contributed to South Korea's birth rate decline. Urbanization and economic growth brought about a shift in family structure and gender roles. As women gained more equal opportunities in education and workforce, the economic and career sacrifice required for having children increased, pushing fertility to new lows. Socioeconomic factors also contributed. High costs associated with housing and education in urban areas have become significant deterrents to having children. So how did South Korea get here?
Following the 1850s Korean War, South Korea and North Korea separated, each embarking on distinct paths of development. After the war, South Korea strived to increase living conditions and modernize. A key concern was the rapid population growth, which was seen as a barrier to economic progress and better living standards. Starting in the 1960s, South Korea's population had reached over 40 million, prompting the government to take action. They implemented the family planning program to encourage young parents to limit their family size. The slogan read, quote, "Have no more than 2 children, regardless of sex," end quote, became widespread by the 1970s, reflecting the government's push for gender-neutral family size limits. In order for families to comply with these new policies, the family planning program began implementing policies and initiatives to convince families to limit their family size to 4, 2 adults and 2 children. Some ways that they could convince citizens to reduce their family size was by using eye-catching posters in public advertisements, free contraceptives and sterilization services, free education programs in schools and communities, and incentives for families to adhere to the new 2-child policy. These efforts were remarkably successful. By the 1980s, South Korea's fertility rate had dropped significantly, contributing to economic growth and improved living standards. What were some of the consequences of the low birth rate? South Korea's persistently low birth rate has led rapidly aging populations and a shrinking labor force, creating serious economic and social challenges. With fewer young people entering the workforce, industries face labor shortages and slower productivity growth. The labor force is expected to decline by 24% by 2044, threatening productivity and innovation. At the same time, the increasing number of elderly citizens places a heavy burden on healthcare and pension/retirement systems. By 2082, 58% of the population could be age 65 or older. Schools are closing due to the declining enrollment, and rural areas are becoming very depopulated. If the trend continues, South Korea may struggle to sustain its economic development and social stability. For example, in 1960, the fertility rate was 5.99, meaning it has dropped over 87%, and it is currently standing at a 0.075 births per woman, less than 1 birth per woman.
Now the big question is, how is the government responding to this problem occurring in South Korea? The government has implemented many measures to stimulate the birth rate by offering financial incentives for birth rate. In the end, these efforts were unsuccessful. According to the Boston Consulting Group, the macroeconomic impact of the age dependency ratio will be felt before labor shortages begin to bite. This includes reduced tax revenues, which then curtails public spending. But both aspects will eventually become a real challenge for companies, some of which already offering significant financial incentives to employees when they have a child. Korea Times also states, in 2024, the government will expand childbirth incentives, paternity leave benefits, and housing welfare programs for families with newborns, as a part of broader efforts to boost the country's falling birth rate. Quote, "The South Korean government is doing as much as it can to raise the birth rate of their country, but it's not that effective, but it's working a little bit. They have given money, given paternity leave benefits, and special programs just to raise the low birth rate of the country. South Korea's birth rate in 2024 was 0.75 per woman, while now it's 0.8 per woman. This is a very slight raise, but it's progress towards the future." This concludes the episode of South Korea's birth rate. Thank you so much for listening. For a transcript of this episode, head to the Point of View tab on our website, nhsmessenger.org, and follow us on Instagram, Twitter, and Facebook at NHS Point of View for updates and new episodes. We're your hosts, Ashrita, Zara, Gayathri, and Jessica, and this has been Point of View.